Welcome back to Good Day Dayton. Joining us in the studio this morning is Dr. Peter Kambelos from the Buckeye Health Plan. I'm very excited to have you in the studio today. There's a lot of kids are going back to school. There's definitely some health measures we need to keep in mind. Before we get to all that, you're feeling good today? How are you doing today?
Pretty well, thank you.
I'm loving that jacket. We talked about it before we went on the air just now. Fun jacket you're rocking over there.
Thank you very much. I'm feeling pretty fun today.
All right, let's start with the basics here. Kids are going back to school. We talk about it all the time. When kids are in that school building, if one of them gets sick, a lot of them end up potentially getting sick. And it's not just with COVID or anything like that. This was well before that was a concern. So what are maybe health measures you can take as kids are getting ready to school to help limit illnesses throughout the school year?
Sure. Well, one of the main things would be really to get kids in with their primary care physician, their pediatrician or family practitioner. And for those who don't have one of those, it's ideal for them to set that relationship up going forward. I think that individual can be a good health touch point and a source of trust and good information going forward. So one of the first steps I think should be establishing a patient-doctor relationship, getting in to see the primary care physician, getting that initial preventive examination, being screened for problems such as vision, dental, behavioral health, physical problems such as blood pressure issues, etc. And then talking to the doctor too about individualized vaccination recommendations that are specific to the patient's unique needs, wants, preferences, and family, and so forth.
You've done a great job explaining that there, and I really want to harp on one thing that you said is developing that relationship with your child and their primary care physician. It can help them in the long run, and not just with the school year, but in so many different ways. I want to take the focus a little bit back to the school, and like you said, a lot of kids, as they get ready to go back to school, health is on the parents' mind. So let's focus on maybe some tips you have for parents to make sure that with their kids going into the school building, that they're being safe. Do you have just some tips that we should be following in our day-to-day as the school year goes on?
Absolutely. Some of the really basic things, and we frequently forget about this, is teach kids to wash their hands.
With soap.
With soap, right? Absolutely. And sing happy birthday the whole time. That's a good length of time to do that. But I think hand hygiene is important. Respiratory hygiene is important. If they cough, to cough into their elbow. Things of that nature I think are important to reiterate to children as they're going back to school.
One thing that I've always heard is you want to make sure if your child is sick, actually keep them home. Don't force them to go to school. From your perspective as a doctor, how true is that, and to what extent is that true?
Oh, I think that's very important, and particularly if the child's not vaccinated. A child can be an individual could be a vector for disease transmission, not only among other children, but to the staff and those who are around them, and then of course that can transmit further to the families and individuals in the staff's family and other networks, and so you can see where that could be a source of significant community spread.
I want to go back to what you opened this interview with, and that was talking about the importance of building that trust with your child and their physician and the help that they can provide, which is day-to-day things during the school year, but also, like you said, maybe building vaccine trust or maybe building just any sort of physical or behavioral health. So what are some ways to start building that trust, and if you have suggestions for a way to get in contact with somebody if maybe someone doesn't already have a primary care setup for their child?
Absolutely. For those who are members of the Buckeye Health Plan, they can go to our website or call the customer service number, and we can direct them to a practitioner who's accepting new patients. That's a good way for them to get a physician when they don't have one. We can certainly help establish that relationship. But I can't overemphasize this enough. It's so critical that children establish that relationship early on in life so that they can build a trust in their physician and their staff, and going forward they'll get good health advice for the remainder of their lives, and then they can in turn teach their own children eventually good health habits.
And that creates a strong public health network, public health system, where we have a lot of people believing in the healthcare system and good health care, keeping our whole network very healthy. We appreciate you giving us all that advice today. Thank you so much for your time.
Thank you for having me.
Of course, everyone stick around. We are wrapping up Good Day Dayton. That's after this quick commercial break.